Anemia. Part 1. Learning objectives. Definitions of anemia. Epidemiology and etiology of anemia. Pathophysiology and classification of anemia. Introduction. Anemia is a group of diseases characterized by a decrease in hemoglobin RBCs, resulting in decreased oxygen carrying capacity of blood. Normal values, RBCs. Men, 4.2 to 5.4 million per millimeters cube. Women, 3.625 million per millimeters cube. WHO defines anemia as hemoglobin less than 13 gram per deciliter or less than 8.07 mmol per liter in men. Hemoglobin less than 12 gram per deciliter or less than 7.45 mmol per liter in women. Normal hemoglobin values are: male equals 14.0 to 17.5 gram per deciliter or 8.69 to 10.9 mmol per liter. Females equals 12.3 to 15.3 gram per deciliter, 7.63 to 9.50 mmol per liter. Epidemiology and etiology. According to the WHO, almost 1.6 billion people, 25% of the world's population, are anemic. The incidence of anemia in cancer patients equals 30% to 90%. In CKD patients, 15% to 20%, and patients with CKD stages 1 to stage 3. Up to 70% in patients with stage 5. Slightly more common in females, 9.9% than males, 7.8%. Pathophysiological classifications of anemia. Blood loss. Example, ulcer, trauma, hemorrhoids. Inadequate RBC production. Nutritional deficiencies. Vitamin B12. Folic acid. Erythroblast deficiencies. Bone marrow failure. Bone marrow infiltration. Endocrine deficiencies. Chronic disease. Excessive RBC destruction. Intrinsic and extrinsic factors. Morphological classifications of anemia or based on RBC size classification. Macrocystic anemia, example, vitamin B12 and folic acid deficiency. Normocytic anemia. Hemolysis, chronic disease, renal failure, endocrine disorders. Microcytic or hypochromic anemia. Iron deficiency, thalassemia, sickle cell. Pathophysiology of anemia. Erythropoiesis. Begins with a pluripotent stem cell in the bone marrow undergoing differentiation and ends with the appearance of RBCs in peripheral blood. The production of RBCs is stimulated by EPO, a hormone secreted by the kidney in response to detection of decreased oxygen carrying capacity of blood. EPO stimulates RBC production by stimulating differentiation of RBC precursors in the bone marrow to become reticulocytes. EPO stimulates RBC production by stimulating differentiation of RBC precursors in the bone marrow to become reticulocytes. Reticulocytes become erythrocytes after 1 to 2 days in the bloodstream.